Today we're diving into a fascinating review about, preeclampsia management and the vital role nursing plays in it. Let's get started.
I'm excited for this chat. So what's the main focus of the review we're discussing today?
Well, it's a systematic review that looks at clinical practice guidelines on the management of preeclampsia, or PE, from a nursing perspective. The authors wanted to evaluate and synthesize recommendations specifically for nursing care in PE.
Interesting. So why is that important?
Because PE is a major cause of maternal and perinatal mortality worldwide.
Right.
Early recognition and timely interventions are crucial, and nursing staff play an essential role in this process.
Absolutely. Nurses are on the front lines. So how did they go about reviewing these guidelines?
They conducted a systematic review of international and national clinical practice guidelines published between 2013 and 2023. They used the Agree-To tool to assess the quality of the guidelines. Then they summarized the recommendations using descriptive analysis and the framework method.
The Agree-To tool, that's for appraising practice guidelines, isn't it?
Exactly. It helps ensure that the guidelines are methodologically sound.
Got it. So what did they find in terms of guidelines?
They identified 10 guidelines, and 8 of them were deemed clinically useful. From those, they summarized 31 recommendations encompassing 46 items on nursing management of PE.
Wow, that's quite comprehensive. What areas did these recommendations cover?
They categorized them into 3 main aspects: antenatal care, intrapartum care, and postpartum care.
Right. Let's break those down. What about antenatal care?
Sure. In antenatal care, there were 18 recommendations. They included assessments and regular monitoring of PE, standardized BP measurements, prevention education, monitoring antihypertensive agents, and the use of magnesium sulfate.
Interesting. Magnesium sulfate, that's used to prevent seizures in PE, correct?
Yes, exactly. It's essential in preventing progression to eclampsia. Nurses need to be proficient in administering it and monitoring for any side effects.
Absolutely. Makes sense. And standardized blood pressure measurement is critical too.
Absolutely. Accurate BP measurement is fundamental in diagnosing and managing PE. Nurses must ensure proper technique to avoid false readings.
Right. You mentioned prevention education. What does that involve?
Educating women about the signs and symptoms of PE so they can seek care promptly. This includes warning signs like severe headaches, visual disturbances, and sudden swelling.
Yeah, that's so important. Early detection can make a huge difference.
Exactly. But here's the issue. They found that the quality of evidence for many recommendations was rated as very low or moderate. That means we need more high-quality research in nursing practices for PE.
So despite the low-quality evidence, the recommendations are still strong?
Yes, many were strongly recommended in clinical practice. It shows that nursing care is critical in PE management, even if the evidence base needs strengthening.
That seems a bit contradictory, though. How can we justify strong recommendations with low-quality evidence?
Well, sometimes clinical consensus and the severity of PE make these practices essential, even without high-quality evidence.
I
The
see.
potential benefits outweigh the risks.
That makes sense, but it also highlights the need for more research.
Exactly. We need more studies to provide high-quality evidence, especially on nursing interventions.
Yeah. So what about intrapartum care recommendations?
For intrapartum care, there were 4 recommendations, including childbirth care and monitoring during labor. Nurses should know the indications for delivery regardless of gestational age, like in severe cases of PE.
Timing of delivery can be a tough decision. Nurses must support patients through that.
Definitely, and providing psychological support is crucial. The stress of PE can be overwhelming, so emotional support is vital.
Absolutely. Psychological support, that's often overlooked but so important.
Exactly. Nurses are in a unique position to offer that support during such a critical time.
And postpartum care?
There were 9 recommendations, including regular nursing monitoring, breastfeeding care, and longer-term health counseling. Nurses need to monitor for worsening of PE after delivery, as it can sometimes appear for the first time postpartum.
Really? Wait, PE can develop after the baby is born?
Yes, it can. So ongoing monitoring is essential even after delivery.
Good to know. And breastfeeding care? What did they say about that?
Breastfeeding is recommended, and nurses should advise on safe antihypertensive medications that are compatible with breastfeeding.
Got it. That's helpful. And the longer-term health counseling?
Nurses should educate women about the increased risk of cardiovascular disease in the future and promote healthy lifestyles. Also, counsel about the risk of PE in future pregnancies.
So it's not just about immediate care, but long-term health as well?
Exactly. Nursing care extends beyond childbirth.
Yeah. This review really highlights gaps in the evidence base for nursing practices.
It does. It emphasizes the need for more high-quality research to support nursing interventions.
Well, it's clear that nurses play a crucial role in managing PE.
Absolutely. This study provides valuable resources for nursing education and underscores the importance of nurses in early detection and timely treatment of PE.
Indeed. Hopefully, this will inspire more research and improve outcomes for women with PE.
That's the goal. By enhancing nursing care, we can make a real difference in maternal and neonatal health.
Well said. Thanks for sharing these insights.
My pleasure. Looking forward to our next discussion.